Good evening and welcome to this meeting of the Family Services Select Committee. I am Councillor Wala Idris, Chair of the committee. I will be chairing tonight's meeting. The event is being streamed live on YouTube, and members of the public and the media are welcome to watch the meeting remotely and listen to the discussion taking place. Now, I would like to welcome all those in the committee room 1 at Kensington Town Hall and everyone watching on YouTube. Before we proceed with the meeting, I would ask members of the committee to please make sure your mobile are turned off or on silent.
And laptops.
And laptops if they make noises. Anything that could make noise, just turn it down. Thank you. And I think also it would be appropriate if we can start the meeting with a 72-second silence. Remember those who lost their lives out there.
Thank you.
Thank you. Apologies for absence have been received from Catherine Williams and Councillor Kathleen Forbes and Councillor Sonia. Have we received any more? No? Okay.
Can I make a shout? On the sheet here it says that Councillor Addenbrooke is a member of this committee.
That's just a printing error.
But it's now 2 meetings or more.
It's the system used to create the agenda.
Yeah. It seems to have got me on, not her off.
Okay, thank you.
Can't we adjust the system?
Which one?
Okay. Does any member have any interest to declare? Okay, thank you. The minutes of the previous meeting have been circulated. Does the committee agree to sign them as correct record? Yeah. Right.
I have a question about membership of the committee.
Yes.
Is it like other boards where if you keep missing, you cease to be a member? I mean, what's the protocol?
I'm not sure, but I'm assuming since we have, as councillors, my understanding, we have a number of meetings we're allowed per year to miss. And that could be, all of them could be family services, maybe, or all of them could be the full council meeting or combination of whatever. That's my understanding, but I can definitely.
There's a certain amount of, if a councillor doesn't attend a meeting within a certain amount of months, I'll double check in the constitution, then they can no longer be a councillor. They can no longer be a councillor if they don't attend any council meeting within a set amount of time.
It's like governance, isn't it?
Yeah.
If you
Yeah.
miss.
But I can consult the constitution and confirm that for you.
In addition to that, I think that the chair can observe and comment to those councillors and to various other whips and people like that if you feel they're not being supported.
Yes. Absolutely. Yeah, definitely. We definitely do that with this. Okay, so the first item in the agenda is item 4, and that is the pre-birth to 5 report. As part of the work group for the municipal year, the committee wished to review service provision, programs, pathways, and partnership designed for children from birth to 5, and the impact of COVID-19 on this group. To that end, tonight we have a joint report from Family Services and Public Health providing an overview of the breadth and reach of services available to support this group. I would like to welcome officers to present, to make the comments before members. And I'd like to welcome, is it Liz Fruitless and Annabelle Sanders? Okay. Would you like to give us an overview and to kick it off?
I'm very happy to do that, and I was joined by wider colleagues as well from Family Services and Education to answer any questions. So I think this paper sets out the importance of the first 5 years, critically also the first 2 years, the first 1,001 days, which is being really heavily evidenced through extensive research and linked to that START agenda, but also importantly the role and impact of school readiness on lifelong outcomes for our children and young people, links to poverty, health, and even representation in our criminal justice system. So that's the context in terms of why this period is so very important. The paper also sets out the range of interventions we have in place, and I think it's probably fair to say it is not exhaustive, but it signposts to a number delivered across our partnership. So obviously from within the local authority, across family services and our early help, and in fact through our family hubs, through public health, and our early years, early education providers, NHS and our voluntary community sector. They are all part of this system. However, locally, our challenge has been we are, despite these services, we are not where we would like to be in terms of school readiness. So we're just slightly beneath the London average, and we know that that was a driver for us to want to look at this as a key area for us. And we're also conscious about the ongoing public health kind of priorities and concerns around healthy weight and oral health, amongst others. And I'm sure Liz may want to answer questions on that in due course. So several years ago, we came together, 2 years ago or so, we came together wanting to look at our system as a whole, to bring our partners together to tackle this in a really holistic way. And we were successful in being identified as one of 5 national trailblazers as part of the Early Intervention Foundation programme, to really look at this system, this age period, and think about how we can work better as a system and what we can do differently. So the key aims of the transformation were to improve the school readiness, with a particular focus on speech and language, to strengthen our targeted offer around vulnerable communities, particularly those with special educational needs and disability, and to crucially identify need earlier and intervene earlier, as well as to promote our public health messages. So as part of this programme, I think the paper says we spoke to 300 families. I think it's actually through the course of this transformation, it's actually reached 500. And over 40 frontline practitioners, and involved them in a period of co-design. And the outcome of that is in April, we launched a new health visiting service, which is integrated, has an integrated management structure with our early help team. And we have strengthened co-location and co-delivery within our family hubs, bringing those 2 teams together that now also sit alongside colleagues with representation from speech and language, offers around parenting, family support, stay and play, midwifery, and our early help colleagues, of course. And we've co-designed a new targeted offer, an intensive offer, which wasn't in place prior to this work, to design an offer that provides additional support for families that are most vulnerable, through up to kind of 21 contacts, kind of in the home and in family hubs. And the paper sets out a number of our kind of deliverables, so I won't go through them all, but I'll finish by saying one of the key outcomes, I think, for us is that we've now got a really well-established partnership board that brings together all of these agencies and different council departments to hold ourselves to account in terms of implementation and delivery across the breadth of that age period. And that's now well established, well embedded, and it's overseeing our 0-5 delivery strategy. Anything you'd like to add?
I think Annabelle set it out well, so I won't labour the points, but particularly public health, I suppose, really focusing on our needs analysis, so we make sure we use our data as smartly as we can. Partnership.
Thank you. I'm going to open now the floor to members for questions. I have Councillor Acey.
Thank you so much. And one thing I would like to ask you mentioned about the challenges. So what causes this challenge and how you can mitigate to overcome?
Do you want to kick off with some public health challenges?
Yes. Some of the big public health challenges that we see, particularly affecting the 0-5s, are related to they come out as poor oral health, so bad teeth that are kind of decaying in sort of young children, in being overweight, and often taking up their immunisations, less children taking up their immunisations than we would really hope and need for kind of communal protection, their own protection. And what we see is these are particular problems that we see in the 0-5s. There are other problems that you see in other ages, but this is a particular problem. And we know that these are not evenly distributed across the population. So on the whole, we see that families where there is more affluence have less of these problems, whereas if you are of a lower income household, your child is more likely to have these problems. Similarly, we see that in some ethnic groups, and we see families perhaps who are struggling where there is substance misuse, mental health problems amongst families, amongst the parents, or if there is families living with disabilities, because we know that those households often have lower income. So a lot of it is driven by deprivation. We also know that health problems are multifactorial, that it isn't all about personal choice, but actually many of it is wider environmental factors such as household income, employment and educational status, housing, the quality of housing. So it's complex interplay between the individual and choices, but also their wider environment and the wider community. So much of the work here is about understanding what the data tells us, and we are increasingly working with our various partners to kind of draw together our shared understanding of the challenges, so that we can better pinpoint what are problems amongst which particular groups, and so that then we can monitor if the interventions that we are and the services that we are offering are actually as effective as we think they are to the people that we particularly need to reach out to. So part of it is definitely about understanding the challenges and then working as smartly as possible together across the whole partnership.
Yeah. So you mentioned, sorry, Chair, you mentioned your partner, social service, and who's doing your partner?
So public health, who are a council service, we work closely with our NHS colleagues, so NHS in North West London. So we all kind of have a common some common aims, and public health work very closely to kind of to use both the NHS data that they have and in a non-live way, but also so that we kind of pool resources where it makes sense, that we approach directly, but also we work closely with our children, various children's services. And as we kind of outlined here in the paper, for example, Healthy Early Years is a public health programme. We go into early year settings, childminders, our sort of family hubs, and we look at how we can promote good health behaviours amongst staff, amongst the little children and their wider ones.
Thank you.
Thank you.
Thank you, Chair. You say we are beneath the London average. How do you evaluate, that the vaccination is lower? Because remember, in RBKC, we have a huge private sector. Do you take that into account?
We do try to, but there is no. So although the private sector is obviously a contributing factor to the healthcare of Clinton Chelsea residents, they are still it's still a minority who receive that. Wherever possible, we do try to use, people have touch points, even if they have private healthcare, for example, they still have touch points with both council services and with the NHS. Some people do, and also with sometimes with schools and with others. So that's where us trying to work across different data sources, we can kind of cross reference and I suppose triangulate. But we recognise that people do have the right to maintain the privacy of the information that's shared, and so there will always be some gaps in the use of private healthcare, for example. And similarly, we have a lot of families, we have a good number of families, certainly, who may seek healthcare overseas, and then there is also a challenge that is shared both within public health and the NHS in particular about trying to encourage those families then to report back what's happening abroad,
Yes.
And inform their NHS GP, for example. It is a challenge.
Yeah.
We're trying our best to overcome it.
No, absolutely. Thank you very much.
Thanks for your presentation. Can I ask a question about SEND? Start off with. So, in the family hubs, you are having contact with families, children, and you have a kind of public health dimension to that services that you're offering there. Are you able to identify, are you doing any kind of early intervention work, early identification work around those children to kind of start to spot issues that might flag up the fact that they are developing special educational needs? That's my first question. Then see what your answer is. And then I'll sort of
I think this would be a wonderful point to bring in Natasha, who manages our family hubs, but as she's taking her seat, I think it's probably also worth flagging the importance of our health visiting checks as well.
Yeah.
So they are like universal contact, and we've got developmental reviews at 12-month period and the 2.5-month period. I think the benefit of having a closely aligned team with our early health services and wider council services will hopefully mean better sharing of intelligence and signposting to services. So it's really important that we work together as a team. We've got a number of interventions for our health visitors to sign on to, both kind of formal ones around health and speech and language, and some sort of BCS delivered ones, and home visiting programmes. But Natasha, in terms of the family hub role.
So the family hub staff, who are mainly people who've been trained in early years practice and nursery nurse standard and early years educators, along with colleagues who run both private sector nurseries, voluntary and our own, and childminders, we've been training them in this thing called Welcome, which is an approach to early identification of SEND needs and also how you support the parent how you signpost, how you do things you can support the family with even before any diagnosis. We've got, in every family hub, we've got a sensory room we introduce parents to really early, so that they've got a space they feel is safe and really stimulating for their child and their specific needs. We have support that comes in, and then we also have, because sometimes attachments and relationships are affected, so we have CAMS, child and mental health workers, who also support parents and with the child as well. So we have a range of people we bring in depending on what the need is, whilst people are usually awaiting diagnosis and maybe access to further services. But we don't use diagnosis as any sort of barrier to accessing services. We try and access what we can immediately. And the other thing we've linked to that is speech and language for many children with a range of delay or learning disability is a big issue. And again, it affects attachment and parental bonding with children. So if you can start working on communication and explore its sense, it's really helpful. So we commissioned a programme from the voluntary sector, which where a volunteer goes in with a toy or book each week over a period of, I think it's about 18 months, and works with the parent of the child to develop that interaction and using these materials to develop speech and language. And although the programme was validated in the USA purely for certain narrow types of speech and language delay, we've been trying it out with children with autistic spectrum disorder and other delay, because it seems to be having such benefits around parent-child relationship, which is so important. So that's just what we've been doing. There's other things we're doing which we can send as well.
So you have contact with the child, and say that child goes on to a nursery. Does that information, do you provide that information to the school? Because otherwise what we're having a set of early identifications going on in the nursery settings, or in the family hub settings, and then the child's going to the nursery and they're having to do the whole thing again and then losing time. So my interest is making sure that information that's been collected when the child is, say, 18 months or 2 years, is then passed on to the nursery. So they've got a record. So as soon as that kid or the child comes into the nursery at 3, the school's ready and knows what interventions will be put in place. Otherwise, you're gonna have repetition, duplication, and you're missing possibly, a significant amount of time. So
you're highlighting a really important part of parental feedback in our research that we did in that early intervention foundation work that we did to create the new pathways. So it's really important that anything we do is recorded in the health record.
Yeah.
So that's the record, the health visitor on, I've got the name of this. So put on there, but also the red book as well, and virtual red book.
Digitised version.
Yeah, and but as well as that, we also support children, particularly the most vulnerable economically, to take up 15 hours of free childcare and early education at 2. And Iraklis, I might seamlessly pass to Iraklis, who is our specialist and lead on that area. Do you want to tell them how we pass on information and how it works?
Absolutely. So hi everyone. So we have introduced a transition record from nursery to school, and obviously we have very close links with our family hubs. So we will have transition meetings and involve all the relevant professionals. And also we have introduced, as I mentioned earlier, a record that is more consistent across the board. We have designed actually this record by involving schools, early year settings, to make sure that we capture all of the key areas that we need to ensure that the next schools will have access to. It doesn't always work seamlessly, especially when the parents did not give their consent, because we can only do this with parental consent. But in most cases, it works extremely well when professionals come together, the SENCO or the class teacher from the next school and the practitioners, key persons from the previous school, get together and talk about their children's interests, needs, the areas that they need to be focusing on and thinking about. And we actually have transition meetings in the summer term between early year settings and schools, where people come together to have those informal discussions. As I said, the problem sometimes being not having parental consent, but most of the time that isn't a barrier. So, and we continue to work obviously with families to make sure that we enable those discussions. So.
I'll probably add to that health visitors, the time we've been working on that transition and link with our school nurses as well to make sure that there's a sort of transfer protocol in place.
There was one other gap that we noticed. There was a gap between speech and language therapy at under 5 and then starting school, and we've been addressing that in the recommissioning the speech and language contract, because you could see there's a fall off where it looked like delay for parents and restarting.
Councillor Scott, sorry.
Another question, it's really tricky to answer this one. You said about health visitors, certain kind of key milestones when you have contact with a child. But some people will not accept that kind of level of contact.
Yes.
So where you've got children going into early year settings, that's great.
Yeah.
You know, you've captured them, you're starting to interact with them and the family, and you can start putting into expenses. But clearly there must be a number of children that are not making contact with early year settings, because we are having children coming into our nurseries who are not toilet trained.
Yeah.
Okay, so there is something slightly amiss there, isn't there? And I just wondered, what your thoughts were about that.
I think that's right. So actually, as a subsequent item, this agenda is our performance dashboard, and actually those contact points, those mandated checks, are a really important indicator. They're not the only indicator of the success kind of at the health visiting and all of this partnership work that they do, but it is an important measure for us. And those checks have scored for all by one of the mandated checks. They've scored really well in terms of the comparator, London comparator, but the area where we have always struggled with our uptake has been that 2.5 year check, which is really a developmental check. Interestingly, from the latest data, so the update on what you'll see tonight looks more promising, but still with the latest data we're looking at around 63% taking up that check. So it is a real concerted effort. I think our hope is that actually by bringing together the offer, the health visiting offer, within this wider partnership and the co-location within our family hubs, it will raise awareness and signposts and encourage more families to take up the offer. I think we're also aware that some families, they don't have any concerns, so they don't want to progress with the review, and we also know that some have their own private health arrangements. But certainly we would like to see an increase.
What may be worth highlighting is that our take-up of the targeted 2-year-olds offer is one of the highest
It's been
across.
fantastic.
Yes,
It wasn't always like that.
It wasn't,
It
and I
came to
think
this committee a few years ago, it was
Yes.
quite low.
So we know that there
You
is a
have done
small.
fantastic work.
Yes,
to-
yes,
to
and
drive
that's down
this-
to the
to drive
family
this
hubs and so we know that there is a small number of targeted 2-year-olds who are not currently accessing early years provision,
Yeah.
and we feel confident that once they are in an early year setting, if there are any needs, they're going to be identified quite early on, and then we will work with our colleagues and partners in the way that we do. So.
Councillor Scott?
Thank you. I very much welcome this report. I think it's got some extremely good stuff in it. And whilst you say it's a work in progress, and I'd agree, probably it is. I think it's bodes well in the future. A couple of points though. One is, interestingly, in the performance paper later on, the schools are mentioned, but they're not mentioned in here. And I know of at least 3 primaries that are doing 0 to 11 provision now. And that's not really brought out in this paper. It is early days, but it's been a lot of work gone in different parts of the borough to put these things together. So that would be interesting to get some feedback in a future meeting as to what the key performance indicators in relation to the integrated primary school setting, 0 to 11, how that's turning out at the different milestones through progression. Because such things as data records needs to be a problem in that context. I know there's a different Ofsted accreditation from 0 to 3, 3 onwards, but I'm assured by our executive end that's not an issue. So that at least that problem is got over and doesn't. We want parental involvement, but we wouldn't need formal parental permission.
That's correct.
On the system. The other thing is one caveat to my eulogy on this paper is that could we please examine our consciences with regard to this sort of thing? That is a lot of printing ink for no real purpose. And whilst the council signed up to carbon zero 2030, this is not good optics. The whole of this excellent paper could have been done with in black and white for a start, using shades and grids and those kinds of graphic techniques. And the real meat of this is actually in the paper itself. I think this is the most interesting part of any of the paper tonight. And it shows the way to, virtually all the parents there are saying we want one place, one voice, one person, one question, and that we don't want to have to cast around. I had a long discussion with Barry Quirk when I came deputy in the council. He said, if you have one aim, and I said, yes, I want to get rid of the S on our excellent services, so that we have excellent service. It may sound trivial, but actually that's what's there, and that's the real evidence coming from the customers. So I think that the question I'm asking is, do you see future opportunities for more integrated 0 to 11 provision within the borough? Because it seems to have so many advantages across the piece. It also has incredible financial savings as well. We've done the future budgetary arrangements that we're looking for over the next 2 or 3 years with the council. This year's budget, some people thought was difficult, but we're assured by Lisa Taylor and others that it's going to become strategic next year onwards. And therefore, it would be interesting to know whether that integration is being a success for KPIs next time round, maybe, and also whether that's the model which we develop more in the future.
I think both Natasha and I have just come from a workshop with a whole range of health colleagues locally to look at the opportunities around integrated neighbourhood teams, but essentially the concept being that we look to over time align our outcomes, think about joint intelligence, think about joint integrated workforce and capacity, and moving towards a much more holistic view of a person, a family, a community, and that's absolutely the ambition, and Health are really spearheading that. And I think we are very much part of that within children's services, public health, wider council, our schools, and our wider network. So I think it was just, that's an example that our partnerships are really driving this agenda as well. And I think this is a really good example. This particular work is a good example of the appetite, not just across local authority and health, but actually a wider BCS and education sector to come together and tackle something together. So whilst this is a bit of a microcosm, we've developed joint metrics, KPIs, performance measures, and a sort of governance and oversight and one vision. And I think there is scope to do more of that.
So when you say health, do you mean national health?
Yes, I do. Yes.
Because I was wearing another hat. I'm a governor of Justice and Hospital, and getting into the sort of lower echelons of the ICS to be conducting it and all the rest of it, I don't see any papers on this at all. So it'd be very interesting to know who you're working with so that I can introduce them to some of the people who are doing it. Yeah. The NHS seems to be so big, it doesn't necessarily know which part the ethics is doing.
No, absolutely.
Because if you put it bluntly, if we are successful at doing this, will continue to be successful, not will become more successful at that, we will prevent obesity and all the other mental health issues, etc., becoming a tidal wave into the NHS that it can't cope with.
Agreed.
Because this would make COVID look like a minor storm if we get it wrong.
So happy to share that representation. It's sort of ICB and community health providers. We have had some input from acute, although midwifery it's again a working piece to kind of work more closely with. We've been having those conversations. Midwifery can go through their own transformation, which I think
Thank you very much.
Any other questions? Councillor Smoking,
yeah. Well, I'm pleased to see that on a number of measures, this borough does better than average, like London, national. By the way, what is inner London these days? The definition of inner London?
Inside the, that is what one's on two.
The Aurelia, isn't it? The Aurelia.
Yeah. How many? What are we?
I think about 15 maybe
Yeah, I think
that
it's
are in London. So yeah,
It's what, 15 what?
a lot of authorities. Yeah.
Yes.
Yeah, okay, it'd just be nice to know what they are. It might be worth finding out what the
Yeah.
definition of inner London is.
We can share.
Because I can't imagine 15 boroughs in inner London. I can imagine obviously possibly Hammersmith, Kensington, Westminster,
Mhm.
maybe just a couple south of the river.
Yeah, Wandsworth, Lambeth are included somewhere.
But anyway, maybe we can,
It would be true to say that our context is really the North West London ICS,
Yes.
which is 4 hospital trusts, which have 8 hospitals. So about 35 or 40 minor.
it'd be worth finding out what that means.
Yeah.
But
Yeah.
anyway, my
It
question,
is the central hub.
2.2 million people.
yeah. So the question is in the in the needs analysis in 3.4, that we've already been referred to, the current health situation is not great. And it does say, obviously, the report is about what we're going to do about it. What effect are we having so far, and how are we measuring it actually, and also over what time frame are we measuring? So we know we're making progress,
Yeah,
or have I missed something in the report?
there are a number of programs. I think I would say that there's not a specific target for each of the things. So, for example, for obesity or for the immunisations or for oral health, I think the implicit is to bring it up at least to, which doesn't sound maybe as ambitious, but to bring it up to the regional comparator to make sure that we are not behind our peers in the first instance. So in fact, all the services are kind of contributing, and that's part of the complexity of it. So, for example, a health visitor will be thinking about all these elements of boosting physical activity, healthy eating, promoting good oral health. So that would be just normal as part of the early years offer as well. Healthy Early Years sort of program does that kind of as part of its kind of core purpose. So it's almost as if everyone is working towards this, but I agree, it doesn't have, for example, SMART objectives that one might.
I mean, I can see the difficulty in having a specific objective, like reducing the figure by X in such and such a time scale.
Yeah.
But what I'm looking for is what effect we are having or will have, and how that's being measured and when. I'm not saying there's a target, a figure, but we have to know what we're measuring and when are we measuring it, and when can we see change.
Yeah, so we are seeing changes. The way we measure it, we use a combination of NHS gathered information. We use which comes up as part of, for example, in our health visitor checks. It contributes. Our GPs contribute when they do sort of certain data. We know that we have, for example, the National Child Measurement Programme, which goes round and measures all reception children who consent and all Year 6 who consent. We have an oral health survey, which allows that monitoring. So this data is sort of coming in, sometimes quarterly, sometimes just annually, and that allows us to look at the trends over time, and also allows us to break down by boroughs and sometimes, by ward, and sometimes even smaller areas depending. And that's some of the information that, for example, in our joint strategic needs assessment, which and we have a variety of different sort of chapters of it, allowing more detailed information, which allows us to kind of monitor in more depth. So, for example, immunisations, that's you may have had an immunisations report, but there are multiple indicators there, depending if you're looking at use of months of rubella or if you're looking at diphtheria. So all these indicators are collected, the trends over time are monitored, and the different groups, so whether it's by ethnicity or by socioeconomic status. So we get a sense of where are the people, who are the groups, who are the children who are most suffering, who are most in need, and we use this different information over time to see whether the trends basically are looking in the right direction or they're going wrong.
So let's say about once a year we expect a data point.
That's the least, but in some of the information is collected more frequently, so quarterly.
Because you have, I mean, you've identified some very specific health issues.
Yes.
So I understand it's a complex subject, and as you say, there's input from a lot of sources, but you've got a specific health issue. So every 6 months, every year, you'll have a data point for that issue.
Yes.
So that's what I'm wondering how to track it.
Well,
Because you've got to see that the intervention does have an effect, otherwise it's a waste of time.
yes, and I think many of our public health reports are littered with tables and charts, and it might be that in a future report, if you would find it helpful, we can add more of that sort of detailed charts, really highlighting the trends, because sometimes a picture does paint 1,000 words. So we can definitely get, I can give you lots of data, and also we can include more references to some of the joint strategic needs assessments that I've done, which add that kind of that detail that maybe you will get.
Essentially, to find that you're putting all this effort in.
Yes.
What effect is it having?
It might be
That's essentially what I'm trying to get at. That we can see it. Now you can see it.
Building on your point, so because we know we're sort of actually quite data rich in this area, and partners come and different departments come with lots of great data. As a partnership through our board, we agreed on some key measures that we want to hold ourselves to account on, that we want to monitor and track. And some of them you can see here. Interestingly, in our next item, some of them are actually reported in our quarterly report, and that's a report that we produce quarterly and share widely, and it will be available for kind of scrutiny to look at over kind of coming quarters. So we constantly collect this data, but I suppose to reassure you, as a partnership board, we are reviewing that data and progress against that data. We are still on a journey, though. We are still implementing these changes.
Because here, sorry to go on about this a bit, but you've got here historical data. For example, the take up of free early education that goes back. Essentially, it's 4 years, which is fine. But what we can't see here is, and I mean, it's sort of steady. I don't really have any attempted interventions there. Not because I think that's one of your interests to try and get more take up. So at some point, we'd like to see, well, we started our programme, I don't know, let's say 2023 January. We look at January 2024 and say, oh look, take up's gone up, or it hasn't gone up. Maybe we have to change a little bit what we do. That's what I'm trying to.
Yeah, no, sure.
Because it doesn't tell you that here that the programme of intervention started.
No.
You see what I'm getting at?
Yes, no, definitely. It's
Sorry, my voice isn't loud as tape.
No, and that, I mean, it's partly the number of different interventions that are going on. It can be quite difficult to pin down the individual outcomes. But definitely when we have particularly new interventions where we don't have absolute, where there may have worked, well, the reason why we'll have brought it in this borough is because we've seen from either nationally or regionally that it's worked for that borough, so we think it makes sense that it also works.
Sure, of course.
In that situation where we introduce, for example, a pilot or a new programme, we would have built an evaluation around it, and then it has quite close monitoring to make sure that it really is working in Kensington and Chelsea.
Right.
So, for example, the immunisation pilot is a case where we're absolutely bringing in a new intervention, and we're looking at the change in, ideally the increase in uptake of immunisations, for example, we are seeing.
Thanks. I've got a couple of others different.
Okay, would it be a good time to make a recommendation for having a report come every, just have an annual review and have something sent annually and just send it as an informative type. As well. And this way we can start a trend.
And we've obviously made commitments within this report, and we've set out what we want to achieve in the next year. I think there is something about holding us to account on kind of delivery and implementation of what we've set out.
Yes. I mean, even if you have 100 quarterly as an organ for yourselves, for us, I think once a year would be sufficient.
Yeah.
Be very, very happy to do that.
Yeah, good idea.
Yeah. You have 4 more?
Yes, a
more
couple
questions?
more,
Okay.
much
Couple
smaller
more.
ones.
Okay.
A couple. One is to
There you
explain
go.
in paragraph 4.2, there's a reference to tummy time.
Yeah.
Could you please let me know what that is?
I mean, I think we'd all be itching to answer that.
So it's about when you have small babies, they need to go on their tummies
Yeah.
so they can build the strength in their neck and their head. It's an essential part of that they can't learn to communicate or feed if they haven't got strength in their neck. So it's a really important part. Most parents would have done, but actually lots of parents may not feel confident to do it, know how long to do it for, so it's all part of the things that we encourage.
Grandmothers are good at doing it.
Exactly,
I
exactly.
hope I did that with my son, but he seems to cope. My suggestion is this is clearly a technical term, I know it sounds silly, it's a technical term, you might want to put a little footnote, say what it means
Okay,
Yeah,
for people like.
Yeah, because you put it on, yeah.
Right, and the final one so far,
That was good.
Come on, Doris, especially blokes.
especially blokes, yeah, exactly. In paragraph 5.3, it talks of savings of the previous year, £167,000. Excuse me, I'm just curious how that was achieved. Obviously, saving money is a good thing. I hope it is not an expensive quality, which I probably wasn't, but it's interesting to know what you did.
So actually, I mean, this programme has delivered efficiencies actually beyond just 21-22.
Okay.
But I appreciate those are the figures profiled in the report, and it's looked to do that by essentially, I mean, a large part is management oversight. So about bringing those two services together, it provides us an opportunity to be a bit more efficient. And we've also looking at kind of the opportunity for group reviews where appropriate and some such. I don't know if there's anything else you want to add.
So we didn't make anybody redundant, I want to assure you of that. We kept some vacancies, we didn't fill them because we wanted to see whether this working more collaboratively with the integrated leadership team, where I supervise somebody as a joint appointment between us in the local authority and CLCH, who are our community health visiting provider. And so we wanted to see if we could, by looking really in detail, task by task, could we make efficiency? So that's what we've done. We've kept some vacancies. We're going to look at, for example, business support. That's one of our next sort of things in our line of sight. At the moment, it's centralised in CLCH. Ours is in each family hub. So we want to think about, well, if we make efficiencies again. So it's that sort of stuff.
Sounds good, actually. But does that also mean, like, if you haven't filled the vacancy and you manage to work with that, you haven't discovered that actually you still need to recruit a new person or fill the vacancy or something like that? So the saving.
So the saving is just, yeah.
But it is permanent, as it were.
Yes, it can be.
In that sense,
Yeah,
I mean,
it's current. We just kept those vacancies open. We keep them open. I've kept those posted to the establishment just in case something changes.
Okay.
But yeah, professional
Well done.
fill them.
Very good. Thank you very much, Chair.
Okay, thank you. I have, any other questions? I have a question, sorry. Going back to, obesity and oral hygiene. You said it's the certain areas where they're more pronounced covered. Is that because there is a lack of offer in those areas, or is it because of lack of information or a culture of not wanting to go to the dentist and eating healthy?
I think it is a complex mix, probably of much of all of that. Except I would say that I think in our borough we have quite a rich offer. Although I think, as we all acknowledge, making sure that it is as acceptable and as accessible and is palatable to the kind of the people who most need it, whether that's making sure we have access to language and translation and all those sort of disability, all these things. But I think partly it kind of goes back to point I made earlier, which is that complex intermix of environmental factors that affects maybe a family's knowledge and skills and kind of capabilities. That it seems simple, doesn't it, to brush your child's teeth, but that requires a knowledge, requires the means to do that. Even though, for example, and then even though we're probably prepared, many of our health visitors hand out free toothpaste and toothbrushes, but it's to know to ask for it perhaps, and that is an option. It's about having the time. If you've got a family who perhaps are working, parents are working lots of jobs to make ends meet, do they have the time to sit down with each child to do that? Encourage it. So it's complex, but what our current service offerers is definitely increasingly trying to do is to recognise some of these barriers and to make sure that the services on offer help overcome that, build trust with families who are nervous or worried about asking for help, about providing health promotion, education for families, so they know what the recommended tummy time is. What's the recommended amount of exercise that a little child needs? You'd be surprised just how much. So it's a complex mix.
Thank you.
Can I do a follow-up on that? It comes back to this question of having an integrated service with continuity of people running it, knowing when it comes to Barry's doubling down report, that knowing your resident, knowing your customer, if you like, on a continuous basis and integrating the services into one service. It doesn't matter, I think, whether it's a teacher or whether it's somebody who's running a hub. If they know the family, they will ask questions and make suggestions and signposts outside their own professional siloed remit. Because, when children from our school went back to Poland during COVID, we didn't just say, bye-bye, you're welcome to come back. We said, have you got a dongle? Go on the Chromebook we're giving you so you can do remote studying whilst you're away. And then there are other situations where Afghan families in hotels, the teachers would go to the hotels to get to know the parents and their context to see what other problems they had, which might be reflected in the child's behaviour in the school. So it's stitching those different aspects of things together rather than the individual services themselves, and knowing the customer as a person rather than just a case. I think it's touched on here, and it's certainly in the evidence and the feedback I've had as well. I think that is gold dust.
And I think that is certainly what our services are increasingly trying to do. It's part of the conversation, for example, on the 0 to 5 or pre-birth to 5 transformation group. These are sorts of deep dives. For example, just recently we were looking at professionals training, so that, as you say, even though it might not be your original professional expertise, but actually we're increasingly doing training to upskill frontline staff. So, for example, from a health and public health perspective, we have making a contact account training, we have sort of mental health first aid, so this is kind of spreading the good news, shall we say, the good health news across all professionals and volunteers increasingly who work with.
The challenge for us is, and this is a really new challenge for certainly for the local authority, not so much for health, it's recruitment and retention post-COVID. It's a huge problem for us. It wasn't a problem. I've never had a problem recruiting and retaining high quality staff since I've worked in the last 7 years, but it is a problem now. It's a problem with the NHS that's deepening. We know there's reasons for that. So that continuity relationship, we have to really think hard about how we do that. We've got so much churn in staff, and making sure that people then ascribe to the values that we stitched into this programme. Because if they've joined us late, how do they understand the thinking? So we're doing a session with our staff in May to remind them, take them back to that information, what the parents said. Because some people have only joined our journey recently, so they don't know the story of why we're knit together. So it's a big piece of work that we're happy to keep refreshing. going to change.
And I think to that, I mean, you referenced it in terms of NHS recruitment, and we were in touch with it before this meeting. We know that nationally it's well publicised. There are a shortage of health visitors, a number of health professionals, but health visitors particularly. And so we are looking at that as a partnership, because that is a risk for us in terms of doing just as you've said, and actually implementing the programme that we set out to do. So I'd say that's one of our big challenges actually.
Thank you.
Councillor Adam?
Yeah, I guess I would like to ask, tackle all these problems, especially in poor areas. Any sort of programs or to raise awareness among families themselves? Because I remember before COVID, I participated in a program in Westminster with a couple of volunteers, knocking doors and just handling brushing and toothpaste, and we challenge the families, and after that we offer kind of some rewards for family taking care of the kids, and also another program about health security. And when we ask the kids themselves to come to the center, and we provide them with different sort of food and helping them to cook, and after that, whoever finishes the program, we're going to reward the family, not the child. So any sort of
Absolutely. I'll start and then others, because we really this question you've raised is really important. We target, so obviously everybody gets access to universal health visiting, access to childcare should they want it, at 3 years and 15 hours. But we use the new birth data, which we get from our partners in health, so we've overcome that information sharing challenge. We receive it from our colleagues in CLCH, the health visiting provider. We receive it from the midwives. And as soon as we get it in the family hubs, we contact every parent who is in the bottom 30% of socioeconomic groups across the borough. So that means in some wards, it's a lot of the ward. There are pockets, as you know, for example, the Southern Estate in Handstown, we target them. There's only maybe 50 families with small children there, we target them. So we write out to them, we invite them to the hubs. We also don't expect people to travel too far. So we outreach through the Dalgarno Centre, for example. We're great friends with the Dalgarno Community Centre, the Space Community Centre, et cetera, et cetera. I mean, a number of them. We work through Marlborough School, Colville School, so we don't expect people to go too far. The programmes that are then delivered, some of them are door-knocking ones. So our friends, the maternity champions, who are funded by colleagues in public health, come from the community, and they go out and they invite people to do buggy walks and baby yoga, a whole load of things that then encourage people to access more targeted services when they need it, but through creating what one of my colleagues calls their work on the trust deficit, because many people don't trust public services for all sorts of reasons that we understand. So going out there, targeting them, encouraging them to come to really fun, creative, engaging things, but all the time health messages that are congruent, because we've trained everybody together. The maternity champions on the same training as my colleagues as health visitors in terms of some key things. I don't know if others have got more programmes that they target, but that's sort of how we go about it. Same with the 2-year thing the 2-year free childcare that you lead on and have been really brilliant on.
Yeah, so Healthy Early Years London is a good example. So we target against settings that would offer the majority of the targeted 2-year-old places, so they have access to the programme, and they can then promote, if you like, those health key messages amongst the families. Something else that has been really positive is that since September 2019, oral health and health eating have been part of the statutory framework for early years. So actually, early year settings are being asked questions about how they promote all of this. And since then, we have seen an increase in the number of activities that early year settings are involved in and the key messaging in terms of promoting, if you like, those key messages. So again, for once, the DFE actually is supporting us to deliver some of the health priorities, if you like, that we're focusing on. So that has been very helpful. The other aspect, going back to your earlier point, the approach of having the birth to 11 community hubs, if you like, is an approach that we really want to promote, and we're doing more work with schools. And it is in line with the Children's Commissioner report, which was published in October, focusing on the future of the early years education and childcare, suggesting that schools would be good community hubs to have early years provisioning for under 3s as well. But I think it's going to take a bit of time. But obviously, we have our own trailblazers within our borough, and they are actually attending the next head teachers meeting to talk to other heads about their experience. So we are definitely using those opportunities. So we're hoping that in years to come, we will have more schools that will actually operate following this model, and then involving, if you like, some of the key partners from health and other agencies.
The other thing this borough does, which is I still think quite unusual these days, is we still fund lots of voluntary community partners to run stay and plays. So those places that people can come in and feel very, just a lovely experience, but actually there are the opportunities to receive health messages, support with small issues, referral on to more specialist services if you want it. And we're going to review those in the next year or so, just to make sure they're still doing what we need them to do, and fit with all these new agendas that we've been talking about around integration.
Will the feedback on that come in one of the performance reports in future?
Yeah, I'm sure we can do that. Yeah.
Do you use Kensington Leisure Centre for stay and play? It looks like there's a room there which might have been used for that sort of thing.
So there's a lovely new soft play. Unfortunately, we're holding off trying to use it at the moment because there is an economic issue around what's happened to leisure centres post-pandemic and their profitability. So it's been suggested we might be able to access it, but there's issues around funding. So we just need to, so it's a great venue though, so I think we will try and get there.
Because it's not just a soft play area, I was thinking of, there's a room when you go in on the right, far right, there's a room there which I've seen used for kiddies plays,
Yes.
games and parties.
Yes, it is used for parties, and we need to look at it again post-pandemic in terms of what they can afford us to eat.
Any questions from the audience outside? Well, thank you.
You've covered it up.
Thank you. So we discussed, it was very deeply, very deeply. We discussed quite a number of things, from immunization to oral health, overweight, obesity, offering for families, how we can help families, health centers and whatnot. So thank you so much. Also, I would like to note that the committee plan to conduct visits with practitioners working in the pre-birth to 5 service. We deliberately chose to make this visit after the report so that members have an idea and what to look for, what to actually ask about, as opposed to going in blind. So thank you very much. And that moves us to, sorry,
Chair, did you want to give any more information to the officers about visits or do you want to know?
it's on the 3rd of
Yeah.
March.
It was, I think officers thought you might like some further detail about.
Yeah, do you have any recommendations, by the way? Because you did.
So we had suggested between us, from a family hub point of view, Homefield House up near Trent Town, it was Goldbourne Road, which would be some of my services and integrated services with colleagues from public health.
And we thought that it may be useful to visit one of our community day nurseries, that Grenfell Nursery.
So two locations?
2 different locations, and one of our main nursery schools, Goulburn and Maxilla, because that would give you an opportunity to talk to families, and they would have had access to a lot of the things we have described, so it'd be important to.
Can you send us the details of, will they be at the same time or?
We can schedule them, they're all, if you want to, walking distance or very short drives between each one, they're all in the north.
Okay.
So it's not a
So you can have both visits at the same time, visit one and then move to the other.
If you want to do more, if you want to split up, we can do simultaneously. We need to hear from.
And do you have a limit on number of people who can visit at any one time?
2 or 3 would be absolutely fine.
Okay, 2 or 3, okay.
I'm just thinking about the size of the rooms.
No, that's what I'm thinking. Also disrupting the day is not, at the beginning of the day is not a good idea. And an ideal to do it in the morning, right?
Yeah, we have groups going on Friday mornings.
9:30 onwards is what I've got in my diary.
Yeah, if we have more people than 2 and 3 interested to come, we can split it and have 2 and 3 go to one and 2 and 3 go to 2. Yeah.
And then reverse it.
Well, yeah, we can do that too.
We might struggle on the Friday afternoon.
It's
because
just
the
the
family
thing,
is
yeah,
quieter,
yeah.
but we can do the morning.
Yeah, I've got it in as a morning.
Yeah.
I don't
Okay.
know, yeah.
All right, so
I don't know
I'll
why I've got it in.
liaise with Luke and I guess, take care
Yeah,
from
just
there.
use it as a
Thank
venue.
you.
What?
So, we move on to, children and young people performance report, Tori.
What?
Scrutiny has a vital role to play in monitoring the council's performance. And for that reason, the agenda includes a quarterly performance report, which is attached as agenda item 5. This is the first time the committee has included a performance report on the agenda this council year, and there are 2 parts to considering the item. Part 1, scrutiny of the performance information, and part 2, use of the indicators. Would you like to present, or do you want to say anything about?
I'm conscious that Heracles has already given up plenty of his time. There was one point that came from the performance review that I wanted to raise with you because I think it's quite interesting, quite important. So, Chair, begging your pardon for this. So, if we go into the performance review, if you look down on page 7. CYPP priority. Families can access early help. It's on the presentation actually.
Is it?
What's the
There's no page. Page 39.
Yeah.
Page 39. 39. Okay. 41. It's not 41?
You see CYPP priority, families can access early help? Yeah. Are we there?
It's page 41. It's 41 actually, I think.
I am there now, so.
So here we've got a very interesting chart that shows that for 3 and 4 year olds who can claim the universal free 15-hour entitlement, we've got over 2,084 places for children taking those places. That's fantastic. If you look down at those who are claiming the 30 hours, you get the 50. So for those that got quite up to this, it is very complicated. You get universal 15 hours.
Yes.
You can get another 15 hours, but there are certain hoops you have to jump through.
Indeed, yes.
Okay, but frankly, most people should be able to claim that because if you're in work and only less than £100,000 a year, you should be able to claim it. But it's a bit complicated. You can see the numbers have dropped dramatically. We're down to 12, 13, 14% of the original figures that are taken in 15 hours. So what do you think is happening?
They have never been very high. As a matter of fact, numbers have gone up in recent years. When I started working in RBKC in 2019, the numbers were even lower. So what has happened, and I think in RBKC in particular, is that we do not have many families who qualify for the 30 hours because both parents need to be working and earning less than 100k, or in order to be eligible, again, if you had a sort of family where one parent worked and the other one didn't, even if they earned less than 100k, they wouldn't have access to that. And we have a lot of families who would not meet that threshold. And then again, we have a lot of families where one parent may be earning more than 100k, which again makes them ineligible. So I think that in essence, we have either families who earn too much or too little, or only one parent working.
You see, this is a structural problem that is causing us huge problems in our nurseries.
Well, I agree. So because we have raised it.
Because we are running, at Stirling, we're running a nursery.
Yeah.
We've got quite a few kids coming in for 15 hours.
Yeah.
We can't get them to do the 30 hours.
Yes.
And we can't, it's not financially sustainable.
No.
And so while we talk about 0 to 11, which is very exciting, development, this situation is going to undermine that. Because we're not going to be able to financially run.
Yeah.
the provision for 3 and 4 year olds.
Mm.
And actually 30 hours
Yes.
is not actually enough if you're doing a 9 to 5.
No, it's not.
You actually need 50 hours.
What
So
something
this
that-
is a serious problem. Now I know it's been in the news, and we're hoping the
It
government
has,
might shift it in
Yeah.
the budget. But that's why I think when we had our pre-meeting, we were wondering whether the council had a policy towards nursery schools.
Well, one of the
is it something that the council wants to promote, to protect,
yes.
to encourage,
Mm.
or do we just allow market forces to play out? And you know, the nurseries will fight each other for the available kids.
Yeah. These are all valid points, and we have obviously been aware of these issues for a number of years. We always raise this as a concern in our discussions with the DFE. One of the reasons why the model from 0 to 11 within school buildings may be a more sustainable one is that you can actually offer them additional hours to families who can afford it, obviously, for a much lower cost than in the private sector, because some of the running costs within school buildings are already there.
We cost subsidise. We cost subsidise.
Yes, yeah. So I mean, yes. So there isn't really an answer without, in reality, the government.
Having to do,
Mm.
because that's at the expense of children for whom
Yeah.
receive them the budget.
I think my observation, I agree in principle, but my observation is this is I think what you're suggesting, this is a moving situation.
It is, yeah.
Which we're all working on
Yeah.
from different points of view.
Mm.
We are making progress,
Mm.
but we're not making progress at the rate at which we would want to.
No.
And it is difficult.
But if the council has a policy that favours and supports 0 to 11 provision, then we can start to think creatively about the buildings that we have.
Yeah.
In our school estate,
Mm.
about how we can have to reconfigure them to make sure that we can provide
These-
0 to 3, 0 to 4
Yeah.
within that space. And also, you can start to recruit staff because they will have career development opportunities. They won't be just tied to providing nursery provision. They can think about developing as teachers and becoming teaching assistants and going on. So you can create an exciting offer.
We have tried it in the past, and the take-up has not been great. So we've been trying to implement this model for a number of years. In the past 2 years, we have seen more schools coming forward expressing an interest, and obviously we already have 3 schools in RBKC that have started to deliver this model. So I totally agree with you, and these are some of the benefits that we usually list, if you like, when we try to have those discussions with schools. It is an unknown territory for schools, and I can understand why governors and schools in general really need to understand whether this will be beneficial or not. So to a certain extent they can all see the benefits, but it feels quite risky for some schools. But I'm hoping that by having a few schools where this model has worked quite successfully, more schools will actually work with us, and definitely looking at buildings will be one of the key aspects that we want to cover and invest, if you like, in offering more affordable, flexible and high quality childcare. So that's our aim. So,
but I think one of the things we could tie into is what Councillor Smith was saying earlier on, getting some points on the graph, if you like, over time. Because as I do recognise what you say, that this is a work in progress, and it has made progress, but it needs to go a lot further. And the 3 schools that you talk about probably go back a year and they weren't doing it.
Yes.
It's amazing what the falling rules.
Yes.
Indeed.
But are schools encouraged to, I mean, how, because I've seen a couple of situations where a deal were always made, but then it kind of like stalled because the school found out their budget is really, you know, it's not in a place where to absorb anything else, and they didn't want to do anything. So how are we as a borough encouraging? I mean,
Actually, I can speak to that. Being a governor at Park Walk, we've taken on, as have Marlborough, some 0 to 3s, and the borough was good enough to underwrite the potential start-up costs. So if it turned out the first 2 years were not sustainable, the council was meeting, of course, not the school, because we couldn't afford to take it on as an experiment. We are in a position for roles. But actually, it's proven to be very positive and encouraging.
So when did you amalgamate?
Sorry, no amalgamation.
Did you, was it?
Opening a new
A new
childcare
childcare,
centre.
so you didn't have
January
an
of
existing.
formally, no, January. We have a nursery from 3 onwards, but the 0 to 3,
Yeah.
baby care,
The baby care,
is
yeah.
from January. I think all were the same, weren't they?
I think Colville was slightly in advance.
Oh, is it?
Yeah, Colville was about 3 years ago. I think they started quite
Yes.
early on. So, and it has been very popular. So, if I'm not mistaken, it was fully subscribed before you even opened. So, and you didn't have to advertise, which again proves the point that families will probably opt for this provision if it were
I
available.
think the only difference there is obviously you had a nursery provision closing.
Correct. So, we
So,
had a few families,
it's a bit
who were already there. So.
And I think that's what somebody was talking to,
Yeah.
wasn't it? Yeah, it was Richard, making best use of council
Yeah.
estate. So maybe there are other similar situations where you could use the estate better elsewhere and fill these schools that have got falling roles perhaps.
But the borough has supported the schools to look at a number of, this is one area, and the whole SEN provision is, autism provision is another area. So, what schools do now, compared with what they used to do, in some cases is very different. It's been, pretty rapidly with the support.
Any other questions? Any?
So it's about A6 or A5?
Sorry?
A5 or A6?
A6.
It is A6. I thought, I know we A6, okay, just checking. That's on page 44, I think.
Yeah.
On the priorities and milestones. And the first item is about Grenfell recovery. So the current funding arrangements are due to expire. So there's going to be an engagement exercise with affected people. And how much money is left or can be spent? Are we talking about, is that part of the Grenfell Recovery Fund that was spent £50 million, of which the vast majority has now been spent?
No, the youth review is separate, but we are very much looking to think beyond our traditional youth services and beyond those that the council commissions. So we're very mindful to our Grenfell Commission services, although separate, they form part of our offer, community-based offer. And we've started this review and we've been undertaking quite an extensive exercise actually to look at, as I say, the breadth of services that the council might be beyond the council's funding as well as the services we are funding, and produce some really interesting insight actually into sort of mapping it geographically. So yes, we're looking at alignment across a whole range of services, leisure also being one of them, and links with education being another.
Are you getting...
Sorry, at the back of A7, there's a very useful, the youth services that you gave as evidence in response to A7, so that's...
I'll look at that in a second. I'll leave it.
So those are our commission services.
Huh?
Those are the commission, it sets out our commission services.
Yes. You haven't started this exercise yet, is that, or have I, because that says it's due to start, but
We're just launching, so we've been doing mapping
I'd
exercise.
be interested in how the residents react, because I presume you're looking at not the geography, but where they are, because there's a building full of survivors south of Ken High Street, for example.
The engagement on the youth provision will be much wider.
It's borough-wide.
Borough-wide.
Yeah.
But you talk about Grenfell recovery, that's the point.
I think that box
It's
alongside.
not headlined out, it's just a tick on
It's just a tick.
Yes, so it's so if you look down the left, it shows some of our priorities,
Yeah.
and then we link to
Sorry, I
each of
misunderstood.
them.
I was.
I think you're right. It's a little bit confusing. So it's one area of alignment rather than directing. I understand. Yeah.
I think it's probably important to explain this report in its context, because it's the first time committee has seen it.
Yes.
So as you can see, it's mapping the priorities of the council, sometimes from a family and children's services perspective, how we are working towards ensuring that our services are aligned with local priorities. And I believe the next iteration of this will have a separate Grenfell edition.
It does. So we've just refreshed our Children and Young People's Plan, which I think you exclusively were aware of. And so there's a little bit of a reshape of this for the next iteration, for our quarter 3, that will include, we've been aligned to our new priorities. And what we really wanted to do is we've got some interesting measures around what we're doing and the number of children that are accessing and the impact that it's having on them. And we want that to be a quarterly update. So the new report will have a dedicated page on Grenfell related outcomes.
Thanks. And I guess we wanted to test this with you in terms of whether or not you feel this is giving you a strong enough oversight of some of those key areas.
It is, but I feel it wasn't clear. The ticks, it was a little bit, so it's just maybe, now I know, so don't change it.
I do apologise for the print.
Yes, but actually I think iteration, our next, so our slightly refreshed version does have a different layout, which I hope will be slightly less confusing.
Any other questions? Mary?
I just wanted to comment that I thought it was a great range of measures for the committee to look at and ask questions about, particularly when you see sort of things like the 2.5 year sort of visits falling so markedly. So lots of things for the committee to look at, which I think is really good. One measure that I was wondering, there are a couple of measures that I thought were possibly missing, but maybe they're too low a level to be in here, and that's something that the committee will want to develop and think about. One was what happens to our care leavers. It was a bit about their accommodation, not about what they go on to do, and I feel very strongly about our care leavers and our duty of care towards them, so I'm always interested in that. And the other one was there is a measure about school, people missing school, but not really a measure of school attendance or lateness, which, but again, that may be a detail that's, and in a way, it's up to this committee to say all of that, but I thought those were 2 omissions that I would have liked to have seen.
I really welcome your suggestion, Councillor Will, in relation to care leaders. Care leaders will be, in relation to our revised inspection framework, we're going to have a separate judgment, so it's an area that we need to ensure it's equal to judgment, and we were considered to be outstanding in that area. But it's an area that we do need to make sure that we have a renewed focus on. So one in which the committee will, I'm sure, be curious about. And obviously we do have the annual corporate parenting report that you would have heard last time, which does give you some sense of the outcomes for care leavers and all types of children.
And picking up on your point about gender, it's a measure we're really interested in as well, and certainly we've been debating whether to include it. So it may well appear in our next iteration, we can kind of refreshing ever so slightly some of those measures. But it is one that we're looking at very closely.
Yeah, I mean, I think the first time you see something as splendid as this, because I really do think it was good. We're kind of overwhelmed by the amount of information, but as everybody gets more familiar with using it, I'm sure the committee will identify things that they want to see, and I can tell that you will be kind enough to think about including them, which I think will be really helpful.
There's a mention of talking to families in this, which is important. But in the previous report, we had the evidence when you talk to families. The strongest message right there was that they wanted one message, one place, one contact. Is there a KPI that we can put in here to measure progress in that direction?
I don't think so, because you're covering such a wide service area.
But the whole point is, this is, are we transforming culture from a service provider designed system to one which starts with the service user and asks what they need? And it's not, to take the King's Fund's titration, 85% of the population don't look after themselves, 15% in acute and long-term conditions, which is really what we're focused on mostly in the King Fund. We also need to, as was in the financial work we do, the working group, invest to reduce the need for service. It wasn't cutting services and the cost of services. It was investing in reducing the need for service. Stop at 85% going into 15%.
So,
We have a practice model, certainly within social care, which is relational.
Yeah.
And we're committed to have less transfer points, for example, in possibly case. So our social workers, our early help workers continue the journey with the family irrespective of their need. That's unlike any other local authority. And it's a core principle that we hold on to. So a measure might be more around workforce and allocation, and length of allocation, etc. That may be something that might want to.
That's not what I'm talking about. What I'm talking about is, to give you an example, obviously I can't names or go into any particular case. There was a case that I came across recently where a child had been in a nursery provision in a context where they didn't have the expertise or were joined up to other services, such that that child stayed in that nursery provision and didn't really progress. And for some other reasons, it moved to a different institution where there was continuity of progression with staff who did understand how to get that child to progress the best possible in every year. The difference, when it's going to make a difference, is that child, instead of becoming somebody who at the end of primary school will have to go into a special secondary school, but they will be brought to the point where they can spend 20% of their time in special provision and 80% of their time in general class, and therefore with support they'll be able to go into a general secondary school. And the change in their projected life chances resulting from that are astronomical. And it's that sense, how we make progress to a new culture and a new system. It's driven by, from the point of view of the child, not from the point of view of the service provider.
I mean, I think that sort of child level insight is always hard to capture. 2 points though, if I may. One of our new kind of children and people's priorities is that young people feel listened to, empowered, to take action, have the opportunity to co-produce. So we will be providing sort of evidence to support, the progress we've made in this quarter around that. Lots of that's probably going to be qualitative. But I think the point you make in terms of kind of a measure that we can look at is some of those progress measures actually in attainment for some of our vulnerable groups.
And not even for the vulnerable groups, but the children, if a child goes into a school, provides ambitious progress targets that are related to their capabilities and the rest of it, they will progress more. Than if they're in a setting where that's not the option that's provided.
Yeah.
And yes, it's on academic development, but it's also on social and mental health and all the other things. So the question here is just how it's not co-design. What it is, it's integrated work.
Yes.
I'm just trying to think about what council priority that would fall under, and therefore then what measure we might be able to. Because these measures are all
the best council. It's giving the child the best opportunity in their life.
I think it weaves actually, because I think it's a really important point, but I actually think it weaves across so many of these indicators. So I think there's something about our attainment rate, our progress measure, so where children start and their trajectory, that's a really important measure for us. It's about kind of the outcome gap between particular groups and narrowing that. But it really does weave across every single measure, that the point that you make.
But the context has to have the data. Primary school has to have the data to do with progress for all particular groups within the school. And then they have to set targets, the resources to achieve those targets, and then measure progress against those targets, and they have to be adjusted every term.
Yes.
And it's changing to that kind of culture of looking for overall performance, but also looking after the interests of each individual child.
But isn't progress one of those things that is different for different people?
Yes.
So how can you put a target on it?
Well, you can have individual targets and aggregate targets. Absolutely, it's the case that each individual child should be respected in their own context of what their you know, attainment opportunities that are open to them, given the right kind of support. But it's measuring both. It's measuring the individual and also the aggregated for the school. But I mean, you know, I don't know what you feel about this, but challenging governing boards.
I couldn't agree more. I mean,
This
after all, that's how we set head teachers' targets at the end of the year. You know,
When you up it from 2.5 to 3.5, it becomes logarithmic.
you do
Difference
well,
every 5 years.
there's an expected progress
Yeah.
from where they start to where they end. And clearly, if a school delivers a step above the expected, it's outperformed.
Yeah.
If it goes below, that's when you hold them to account. And as council, we'd be doing that across all our schools, and that's how we have so many outstanding and good schools. But the expectation has to come from here rather than just the governing boards. It's kind of what you said, isn't it? Yeah,
And you only have to make about a half point progress to be going logarithmically. You didn't just up it.
But coming back to what we were talking about, of course, resourcing helps enormously, doesn't it?
Yeah.
So all of the joined up thinking that you're suggesting, for example, about the using of the state, etc., to enable schools to have more resources, will enable this much better. In a nutshell.
Any other questions?
I think the plan is for you to see this quarterly, and obviously as you become more familiar, it may be that we want to refine, re-identify ones that we feel that
And it's
are
very
missing.
easily digestible. Makes it more beneficial. Thank you.
You won't put it out in colour. No, I totally agree.
I love colours. I
totally agree. We may get paid for this one day.
She asked me where you do the printing, is it just on photocopies at the town hall? I only bring it up because I brought this up at one of my schools where I was horrified to see colour printing going on like this, and it's all printed up north, and it costs a tuppence halfpenny. So it's very different to photocopy printing, which, as you say, is ridiculous.
I do think we are moving far more to paperless. This is a very rare occurrence actually for us to have paperless.
Having said that,
encourage councillors to have a tablet?
Okay.
That was a reflection.
Okay, I'm gonna have to rein it in. So, we're falling a little bit behind our schedule. So, A6, of kind of killed me now.
But that's my list here, the figures about the commission use services, about Almanar.
What's the question?
What,
I would like to ask about this, use services, commission use services.
so that's A6.
Yeah, not yet.
We're on
Are you sure?
A6.
Are you sure it's A6? It's A5, isn't it?
No, it's at the end of
That's A6, yeah.
Sorry, I missed it before I referred to it as A7.
So we're coming to A6, okay, so we haven't forgot about you.
Because,
Okay.
Discussion was A5.
On the 17th of October, 2022, Family Services Select Committee presented the working group report on school and parents' views on serious violence and exploitation affecting children and young people. This report offered key learning and recommendation on serious violence and exploitation affecting children and young people in Kensington and Chelsea, and made 6 key recommendations to the lead member for Family and Children Services, the lead member for Leisure, Culture and Community Safety, and the Metropolitan Police. So, I would like to, would you like to say anything?
Yeah, I think I probably need to provide a bit of context.
Yeah.
because
I was going to also say a little something, if I'm right, about partial acceptance.
I think it's important to say, or to remind members that in the previous year, a number of working groups were formed, and that this was a particular priority that came, or a work group that came, following on from the presentation of the Serious Youth Violence and Child Exploitation Strategy. And members, in particular, the member Councillor Doran was the lead of that Task and Finish group, along with yourself, Amanda, who wanted to ascertain a particular focus in relation to our community's experience, and they went about doing that by meeting with a range of school providers and family members, etc. And therefore then we produced that report that you would have seen in October of last year. I think during the period of time that the report was being developed, we also, within Family Services, Children's Services, we had an inspection that was aligned to a similar theme, it was on child exploitation, and therefore we felt in some respects there wasn't a marry between what our inspection was saying and what the report may have been telling us. So we had quite a discussion in relation to that, and the report finally came here in October of last year. And therefore our lead member, Councillor Fawkes, had the opportunity between then and now to consider the recommendations with officers and think about what was agreed or not. I think that one of the things that was part of our kind of discussion during that period of time was that officers wasn't aligned to working groups and therefore couldn't provide certain information in relation to some of the contextual issues that we may know. And certainly Councillor Doran was very keen to say, don't worry about that, we expect that to be in your response. So I think what you've got now is a response that provides some of that information. So hence the reason that so many of it is partial, because I think we're providing so much more context than maybe the working group had privilege to see.
I think I'd like to go further, and I did say, following on, so it was my first working group. Following on, we had a robust meeting. It was a good meeting, and what I would suggest for any working group that ever delivers something like this piece of work again, that they always start with a meeting with the relevant officers, and quite extensive, maybe not just even one meeting, several meetings, where all of the information concerning what they're seeking to explore is gone through. What I think this working group did, I'm afraid, was have some meetings with some interested parties without perhaps the right background, so perhaps therefore the information gathering came about in the wrong order. And I think therefore, so absolutely I concur with all of the partial acceptances of these recommendations, and I can quite understand why it is that, because actually some of the things that some of the parents, for example, were seeking, the council actually does provide. Yes, the recommendation perhaps might be we might better advertise whatever it is, but the recommendation perhaps shouldn't be, I'm not giving any particular one here, that needs to be provided. It is provided perhaps in some context. So I think if you do that with that comment from me in mind, you'll have a better understanding.
Chair,
Thank you, Linda.
No, I felt very strongly at that meeting that that was correct.
Chair, if I could I support that point too, in a different context, which was the budget working group for the Opiate Scrutiny Committee. We did the work in that in two phases at the recommendation of Taryn Eaps, the previous legal financial. She said that what we needed to do was to go through each department on budgets with officers to get up to speed on the thinking about what was happening, because their briefing to the council as a whole, either the leadership team or the OSC or whatever, was that we were going through a structural change in terms of budgets over a period of 3 to 4 years, and that therefore we needed to understand that context before we started asking questions. And when we came to have meetings with the members and their supporting officers later, when policy issues were being addressed, that was a very useful background. It was bluntly getting us up to speed strategically with background knowledge. We were able to ask some very well targeted questions as a result. So perhaps this is a message not just in the context of this table, but back through our scrutiny officers in terms of thinking about our methodology with regard to scrutiny in the future.
Yeah, I have actually, Councillor, looked at our guidance and I've revised and refreshed that.
But I think it's very useful that we've had a similar experience that Amanda's.
You see, I mean, for example, I mean, at the time, somebody asked me, would I like to lead on a working group, which is really quite ridiculous when you think I've never even been in one. And then having been in one, there wasn't guidance about, we went about it properly. There was a lot of discussion, but actually there should be a tick box thing. Have you done this? Have you done that? Have you done the other? Checking that you've gone through everything before you presume to advise officers or council members about what they should be doing. If actually, I mean, we're coming at as we're effectively lay people on this as scrutiny, but our job isn't to rubbish things. Our job is to seek where something might be excellent, how could it be more excellent, or whether there are any gaps that need filling. Exactly.
Okay. Thank you. Can I help? Councillor Adam, you want to ask a question?
Yeah, here, page 59. About excellence, I think, about Almanar. Because when I look about the community, the money that are being given to Almanar, it's 35 years.
I'm terribly sorry, Mona, I can't hear you very well. Would you mind?
Just raise a concern here about Almanar. It's getting 35,000, okay, for the youth program or services. And when you look into it, there is no number how many of young people attending, and whether it's females and males, and what the activities they're providing, and how many hours. There is no specific information about it. And if you see where the Almanar allocated, I think there is really a very vulnerable area where there are a lot of youth and parents complaining there is no activities for them, especially between 12 to 17 years old. And in what ground they're being given this amount of money, and what the services they're providing, and whether there is any measurement for what they're doing. And I think we need to tackle this. It's not just Almanar. All the youth services in the area, especially the north, Kensington, I think we need to look at it. And what we're looking for, measurement, the methodology of what they're doing, the program they're providing, and how many people are attending this, and whether there's any observation for what they're doing, and if the communities, not one community, benefit of what they're doing. I think we need more information, in particular on
If I can just then
I'll
I'll hand over to Annabelle.
So sounds annual.
The youth provision was subject to major consultation, a very robust consultation. Actually, it did come to this scrutiny committee in terms of its methodology and in terms of how the revised youth content process was going to be made. We're just about, has been alluded to in other papers that are before you, to begin a recommissioning process of the youth commissioning offer, starting in August of this year, but it's likely to go on in terms of that extensive engagement with communities. And we learn an awful lot about what certainly families and children and young people were saying that they felt the youth provision didn't provide and what they would like it to provide in the future, which led to the procurement of a range of services.
Yeah. I think it also gave us a bit of a framework against which to evaluate our youth services. So some of the things that you've mentioned about what do they deliver, when are they open, how many attend, what's the breakdown in terms of age range, gender demographic, you know, that's the information that is a really important part of our ongoing monitoring, but also now will be key as we think about the provision going forward and the next youth review now, actually. So it gives us an opportunity to evaluate and consider this provision for the future.
And also, because I visited the Almanar, there's a lot of going on in Almanar at the moment. And when I visited all these programs, delivered by not young people, and they don't have a youth officer or even to look into what the youth need in the area. Because I think it's a time for the council itself to see how these programs are being delivered and whether the right people listen to. I think just prevent more problems in the area.
Yeah, I agree. And I think consultation is key. Is going to be key. Yeah, thank you.
So we're just picking up on Mary's point. There must be a contract with.
Yeah.
With the service
With metrics that we get information back.
So Mona, that information is available.
Sorry?
There is a service level agreement between the council and the charity.
Yeah, there's, but what we'd like to know, how we measure what they deliver and whether the right people there. And because when I went to visit the youth center, it was closed, like a couple of times. So when they deliver the services and what type of people attending there, who's running the programs. And especially also some people came to our surgery raising concern about the young people, they don't have a place to go.
So that's a point about the quality of information you guys are getting and being able to monitor.
So it's I guess it's a case of monitoring and having spot checks and spot visits to make sure that things are actually what they say they are.
Yeah, and also when I went to visit the center itself, a lot of leaks. So there are two rooms with the leak. So if there is a leak there, whether there is services provided for the service users, I'm talking about Almanar because it's my ward, but I'm not quite sure about other centers. And I see if people come out to us and talk about it, so it's raised concern. And I think it's worth it to look in different areas, not just Almanar, because at least I'm going there once a week. But again, I visited the center itself. The center was closed, and when they opened it, the door was they struggled to open it so that not often open. And of course, it's 2 rooms. There is a huge leak in that center. So how they provide the service?
Do you think we could take this offline now and follow it up?
Yeah.
We will certainly follow it up. We have youth ambassadors funded through our Young KNC Foundation, who are our youth way of looking at quality, as well as officers who monitor contracts. So we'll do both. Yeah, we'll take it away. Thank you.
Yeah.
Sorry,
Any other questions?
Sorry. If I may say, on that point, I think it's not really just family services. Across our services, we provide excellent services. I mean, there's no doubt about it.
Yes.
You know, but I don't think there are not enough spot checks. You know, there are not enough data coming back from the contractors saying, "Oh, we've done this, we've ticked all the boxes." It's great, you know, but I don't think there's a strong enough scrutiny by spot checks that, you know, are these people there? You know, are people happy with it? And
We do for youth, honestly, we do for youth. We may have missed that one, and I'll go back and check. But we have youth ambassadors doing it. We do send our commissioners and people who manage the contracts. They just sit in an office looking at data. They honestly go out and they don't give notice when they're going out, so they just turn up. But thank you, we really will go and check this one.
Yeah, we will.
Yes, Councillor Essen.
Thank you, Chair. This is the same page, 59, and North Hull Lancaster Youth Club. The 10-year project Tuesday work specifically with young BME and LGBTQ. So I would like to know the age. But it doesn't mention the age of the young people.
What page are we talking about?
Page 60,
59.
59, not have Lancaster, the top one.
I oversee Lancaster Youth Hub. It's one of the two that the council have been running. Most of the rest, as you know, are run by our partners in the voluntary sector. So most of our children attending sessions are 11 to 19, sometimes a bit older if they've got SEND needs, but mainly 11 to 18 or 19. But we have different age sessions for different. Sorry, we have sessions for different age groups. So we often have under 50, sort of over 11 to 15, and then we often have 15 to 18 because their needs and their interests are different. So it would be rare we'd have 11 to 19-year-olds in one single space doing the same activity. Safeguarding, exactly, but also interests really different. Yeah.
Third question, do we, you said these are the ones we're actually running ourselves, but the others are run by outside people. Is there any reason why we're not running everything?
Yes, well, we made a decision many years ago, which was followed up by the youth review, where we'd spoken to 1,000 plus actually children and their parents, where it was seen that a diversity of providers would reach more communities, more locations, and that also our community capacity in this borough is tremendous. We have great community spirit, knowledge, wishing to volunteer. So actually, every pound we spend, we're probably getting about £4 back. I can't remember, there was a calculation. Return on investment. So it was not for us to run, it was better for, particularly in times where we had diminishing income.
I was going to say the youth, the serious youth violence working group found, speaking to parents, that within certain sectors there's an antipathy to council provided services, and if you're trying to engage with some of the more problematic families or at-risk families by offering them a third-party intervention, it's more positively received.
But is the third party from the community, or is it an outsider providing a service?
Mainly from, sorry, you give him.
No, almost exclusively they are local providers who've been operating for many years within our borough. And at the point of the youth review, we heard really strongly from the providers, from the breadth of providers, from our children and young people, that they wanted to have this choice and diversity. And that's when we changed our funding to support some of our local services that were already well established and well loved.
Is it true that in addition to funding, that in many cases you also helped them to improve their governance and their breadth of expertise, and to demonstrate that they could do what they really wanted to help their professions?
Through the John Lyons Trust partnership we have with Young KNC that was established, that's been building that capacity around governance skills.
Some of the training we've also been providing lots of support around safeguarding and working with us. They're very much part of our Early Help network.
Yeah, I just ran with Police and Community Safety Police and Nicola Butler, who's the chair of CEO of Young KNC. We've run twice now a course for youth clubs about how to respond to incidents of serious youth violence. So it's that sort of stuff where we collaborate and then share the learning.
And then also the link into other services of the council. You mentioned safeguarding, for instance, that can be the point at which you have to flag the referral to the statutory services.
Absolutely. And in fact, they were part of that training to flag up their sort of duties around that.
Okay. Thank you. Any councillor?
I don't know where we are exactly. Page 67 has a pyramid or triangle that has specialist targeted and universal. The typation that's used often in papers. What would be interesting in this context would be, is it possible for you to illustrate how many people there are in each of these groups, and what percentage of the finance that is spent in those groups as well? Because it probably, if my understanding is correct, it will be very much fewer people than specialists, but the amount of money and time that you have to spend per person or incident, or however you want to measure it, much higher. But if we get some overall feel of where we put our money, because I think one of the things that has come out of various conversations in different contexts come across recently is that there's a willingness now to look not just at making sure the specialist is well done. That's a sort of, it's probably the normal way that organisations look for who's the most needy and you focus on them. And that has a really good logic to it. But there's also logic to investing some money in the universal provision such that it actually reduces the movement up the pyramid, or not cutting the service, but actually reducing the need for the service.
And actually what you want to do is make sure that you're pushing anybody and specialists down and reinvesting as much as you can in that intervention.
So you have to balance between those.
Yeah, it's demand-led, isn't it? But actually your services have to be well equipped in order to prevent an escalation, a rapid escalation.
So how could we have an insight into that balancing between the different provisions? I mean, is it possible? I mean, I was going to start off by how many people in each box, and then roughly what the overall spend is.
Interestingly, on the performance data that you had, one of the comments that Bishop made was that you don't have any help data for you, so you're not seeing how many families are being supported by early help. So that might be one area that you would want to request going forward.
But to go back to Amanda's point, I don't really know the precise question that I'm asking. Could
Well,
you have a think about what I've said and come back with maybe something that would be useful for us to have
Well, it's interesting, we had a little side conversation before this meeting started about exactly this, didn't we? That unfortunately, All Saints recently has had to exclude some students. So those exclusions are subject to appeal in the process. But it caused governors to look even more closely at what we might do at an early stage. To have we done everything we could to intervene? Might we do more in the future? Are there mentor programs that we might get involved with where we can target even more of our vulnerable young students? And I know certainly that was sort of whole premise, wasn't it? Looking at serious youth violence anyway, is sort of really looking at where the money is best spent. And actually I think it's the lower down the pyramid that you go is most best quality, best value for money, but at the same time that willingness to keep never giving up, and it may get more costly, and that's my only concern, is if we suddenly look and we see it get super expensive for a student at the top, you can't say, well, that's not a good use of money, because it's always a good use of money. So,
But on the other hand, as I keep going back to the presentation in this room by the King's Fund about 5-6 years ago, is if you don't look after that 85%, the 15% from 16%, it's like the situation we're in with COVID.
It ties in with so much that we talked about this evening, doesn't it? Because Richard, directly your questions around early identification of SEND. We know that the sooner that you identify and therefore begin to support children or families, you can reduce escalation of demand and need. So a lot of the work that you've heard today is lending itself to that very subject, I would say, which is around realigning services, integrating services with other provisions, so there isn't duplication, there's efficiencies within that, but making sure that we're catching those children at the earliest opportunity to prevent an escalation of demand.
I would say I've always liked the term the team around the child, and that should be the case, shouldn't it? Right from the minute they're born, almost. That there is a relevant team around that child all through its life.
Maybe we could ask you to have a think further about how we could improve our conversation as a scrutiny committee in relation to that issue of balancing, because obviously the ones that are serious and specialist probably present in a very immediate way. I mean, like your case comes up on the exclusion. That then got you to think about.
Unfortunately, there weren't necessarily any indicators beforehand.
Right.
And actually we are seeing, certainly in relation to adolescent mental health, we're seeing young people presenting in A&E that haven't been known to services previously. We are in a very interesting time post-pandemic. We're seeing some very unusual trends. So I think that we are grappling with some of those anomalies that we've not seen.
Going back to youth service provision, the more children are under the eye of a responsible adult, the more likely anything is going to be picked up, isn't it? Whereas if children finish school at 4 o'clock and then that's it, they're left to their own devices.
It's a very interesting work going on at Chelsea Plus Charity in regards to providing apps for youth to look at their own mental health from their own point of view. Not self-diagnosed, but at least try to keep themselves fit and learn how to access help in a way that suits them rather than
makes them more
the older
resilient
person
rather
way
than actually makes them more vulnerable.
Yeah.
It's really important, I think.
So are you finding any difference between females and men, or is it more or less along the same line?
In terms of
In
mental
terms
health
of-
or seriously,
Both, in terms of, are you feel, is it more, there's more women than men, or vice versa?
I mean, in terms of tier 4 provision, so that's the highest tier, I think it's probably, I would say, more females. But the numbers are actually relatively small, so it can change quite dramatically. Actually, I'm thinking of 2, and one's a female, one's a male, actually. 2
So
that really
in
screams
acute
about-
inpatient
Yeah.
treatment, yeah.
And is it the same as before pandemic, or has it, or is it, has there been a shift?
We're seeing a shift in preventing mental health. CAMS has high waiting lists, for example. We're being consulted on whether or not we might be able to develop some services with some CAMS funding to try and prevent the waiting lists. So there has been a shift, I would say. There's also been a wide media campaign, isn't there, in relation to people becoming more mental health aware. So I think that we've got the pandemic, we've also got the public awareness and people's awareness all coinciding with one another.
One of the influences of things like social media.
All new phenomena, aren't they? As a society.
And that's driven vulnerability that we used to see. I don't know what your experience is, but certainly we used to see children in primary school. We were worried that they would become vulnerable when they went to secondary school. The age at which they become vulnerable, if that's the right way of putting it, is now got younger and entered into the primary school.
Any other questions? Okay, thank you. I think we kind of like chewed over this topic, and thank you for the recommendations. And going forward, I guess we'll, whenever we do a group, working group, we start with the officers and then carry on. Not the other way around. And that brings us to item A7, work program report. The committee is invited to discuss the report and approve the work program for the next meeting on the 19th of April, 2023. I'd like to invite Jackie Hurd, statutory scrutiny manager, to comment on the work program before inviting anyone. It's a workshop meeting.
Okay, right. Your next and final meeting before the AGM is on the 19th of April. So at the beginning of the year, you looked at all the topics that you wanted to look at, and Paola worked with Wella to plot them. So at your first meeting, you looked at children and young people not in education, employment or training, and officers provided a report. And at that time you were of the view as a committee that you'd like to go out yourselves and speak to some young people, maybe do some visits and come back with a committee report. So that's still on there. If you feel that you want to do that, because you've had the office report, you can do that. And I know that some committee members have been talking about other things that you might do at that meeting. So I spoke to Sarah Newman today. She gave her apologies because she couldn't come. So for scrutiny, it's good to talk to the exec director and find out if there's anything scrutiny could usefully look at to help the directorate. Sarah suggested 3 things. You're not obliged to do any of these if you don't want to, but it's where she thinks it might be useful. So the first thing is how the directorate are working with health and schools colleagues to prepare for the new inspection for children with special educational needs and disabilities. So that's something on the new inspection for SEND. The second thing is how communities are utilising libraries and whether we've got the service offers in each library. So libraries have just come into this directorate from somewhere else, so Sarah's looking at that. So there's SEND, libraries, and the third thing she suggested was how we are responding to increased school absence and the increase in reported mental health issues that don't meet CAMHS criteria. So it's really whether you want to do the NEETs and any of these. It's good scrutiny practice that you wouldn't really do more than 3 things at a meeting. Also, you can do it properly in your capacity. So to answer Amanda's question, a wash-up meeting would be, I would sort of work with you and get some views. I'd also talk to officers and the lead member, just to get some ideas of what you've done this year, what you think's gone well, what you might want to do more of, what you think's missing, what hasn't worked. So I would, as I say, work with you, but also the people that come and contribute to this committee. We could have a discussion and that would help inform how you work as a committee. So those are the options.
Speaking personally as somebody who's highly involved with schools, I'd welcome Sarah's suggestions 1 and 3 around SEND and the absences. In fact, we were even talking, weren't we, about wanting more information about absences. And I know certainly at our schools we have seen a drop. For all that we're above national, it's dropping. So I think that's very interesting. And then from my own personal point of view, I would be very interested to learn about libraries because it kind of word on the street is they're closing all around the place, and is it a good use of council money to, you know, how are we using them? Are they going to be more active centres for these families that need more support? So I think that could be very interesting.
So you could do a lot of visits with that one. So looking at the offers, you could go to the libraries and see from your perspective, are the offers in there? You could even, as I've said to Ella, you could actually have your next meeting in a library. You don't have to be sitting in committee room 1.
Can I just go back to the NEET, children not in education, and you then mentioned talking to young people, but you can't be talking to these children not in education because we can't get hold of them, we don't know where they are. So I wasn't quite sure what that young person's visit was.
Well, what we do with that, I could talk to colleagues here and also in the economic development team. So it might be having a focus group if they think that that's appropriate. But also you could go out just to get any other views on service provision for that cohort.
So you're not talking to the young people themselves, you're talking to
I'd
people
have to
around.
get a view from colleagues about whether that's appropriate for you to do that, because there might be safeguarding issues.
It's partly possible, it's just whether or not when we commit them to something, whether they come to the meetings. Exactly. I know that's quite tricky with
They
them.
wouldn't have to come here, it would be more like we'd work with you if you thought it was appropriate, that councillors could maybe, as I say, go out to a focus group and come back or something like that.
Yeah, I mean, I think it's just, I know having tried to run these groups, sometimes actually we promise lots of things, but then young people's lives get a little bit messy, so we don't always get them there. We could definitely try. And we also have some providers like Spear who definitely have those young people because they're actually the ones who actually started going to the group. So if we might ask Spear if they facilitate something.
If that's what the committee decides to do, I'll work with Natasha and come up with a plan.
I like the libraries because I think the libraries have been really underused, and I think there is a potential for libraries to become the heart of every community like they used to be.
Well,
back in
books
the
are
day.
making a big comeback at the moment, aren't they?
Yeah,
So-
but even without the books, there can be a place where people can do homework clubs, can go learn about IT, people who just want to get out of the house and be warm, have a coffee and a biscuit, you know, that kind of thing. So I think we really need to be proactive and kind of like think outside the box. Dory, sorry, your hand's been up.
Well, I don't have to say much because I agree with the points made about the libraries. Using the libraries, and I have a library, of course, in my ward. One? There you go, Notting Hill Gate Library. As it happens, yesterday, my fellow ward councillor and I had a meeting with a community engagement officer. And amongst other things, we talked about exactly that. Maybe not in the context of youth services, but we actually did mention things like maybe a homework club and so on. As it happens, we don't have state schools in my ward. Doesn't matter, but you know, Fox Primary is just south of Notting Hill Gate, Colwell Primary is just north of our boundary. We have to, in this particular case, depends on the services, but I just want to put on the table, we have to talk about the hours, because my local library's got slightly wonky hours of opening. And the question is, do you want to have it open to the general public when we want to have a service in it, or close it for the general public? And in the case of my library, there's no space where you can have a private meeting with somebody, so you have to put a door in. I think I know where we could do that. We could cut out half the library and half the books, but for a special service it may not matter. And I think you can put a door in without wrecking a very beautiful ceiling and so on and so forth. So I'd just like to support the idea of utilising our libraries for this, for any service we can.
Thank you. Councillor Essie?
Thank you, Chair. I think the 3 points raised, they are all important. And you know, I sit the library, North Kensington Library, for my surgery, consular surgery, and I have seen it was well used by children to help it. It has a ground floor, and whenever you know I go for the surgery, I've seen it's full for children, and they get the support they need. So I think some of the libraries they are overused, and some libraries maybe they are underused. So, but not considered they are doing well, and you know, and I have seen children that help. My question is, young children not in education, does that mean, dropout children, or children who never attend education? So this needs clarification. What it means, young people not in education?
16, 17
School dropouts.
It could be anybody of school age, can't it, that isn't accessing education for any reason.
Needs.
Yes.
So not in education.
Yes.
So it could be a 16, 17
16.
Done
It's
IGs,
not
done GCSE.
3 age, is it? But it could be doing something else.
We do collect data.
We collect data for year 12 onwards.
Yeah.
That's our up to year 14. Yeah.
What is year 12? Is it 16?
Post
Yeah?
GCSE.
Year 12 is the first year of A-levels.
So it's a 16 plus.
So once they've finished the first part of that education,
It's a 16 plus.
After that question.
Okay.
Did you have a question?
No. Any other question? Oh, okay.
Yes, I, in terms of looking forward, one of the things I'd like to follow up on is this integrated provision from 0 to 11, because that seems to be the foundation on which everything else is going to be built. The reports we've had back today mean that that process is an intent and it's being implemented in a few places. And we've had difficulties as to how that might be rolled out further. And there are perhaps other models in hubs and so on. So I think that looking at that 0 to 11 integrated service provision, because of the potential advantage that has, setting the scene of the child's life and your business about the wraparound team, that would be the same team for 11 years.
The only issue is if you're going to look at that piece of work, family and children's services can't do it on their own, because you've also then got to look at the sort of building services side of things, the people who deal with the assets, the stock that will have, isn't it? You've got to look at the whole,
But
it's a whole
in
big
scrutiny
strategy.
terms, it's rather like when a couple of years ago I chaired the environment. And we looked at water and warmer homes in the context of climate change from the Environment Select Committee, but in terms of social advantages of warmer homes for the Marine Council stock that had been insulated. So it can be a joint working group between more than one scrutiny committee if that's what's needed. And it certainly may need to be led by, I think this should be led by this committee and this officer group. But as has been illustrated today, you were saying you just come from a meeting today where you've been working with NHS and voluntary sector and all sorts of other providers looking for an integrated way forward. Personally, I'm making this a suggestion that, for me, that's the most important thing that I would like to look at.
Well, that's got to start with council policy, hasn't it?
Oh,
You as a
absolutely.
council have to decide
No,
that that's
absolutely.
your priority.
Absolutely.
We can't scrutinise that
Something
thing if
that
it's not your declared.
Yes, we can.
Can we?
Yes, the whole
Yeah.
purpose of scrutiny is to scrutinise policy just as much.
So we
Not
can
make-
suggest.
We can't make policy decisions.
No.
But what we can say is, you, the leadership team or the officer corps, are not looking at this issue, we feel, or have you looked at it, demonstrate to us how you looked at it. All sorts of things like that. We can't do it, say you have to do this, that's the leadership.
No,
The
of
leadership
course.
team makes the decisions, officers provide the support and the enablement. We
And
provide
we
the
decree.
communication.
Well, honestly, this idea would solve so many issues. It would completely support young people. Actually, it could help
And it-
the funding others
And,
as well.
and the cultural change council, and becoming the best council is the vision under the new council plan. But cultural change that is inherent in the development of the council plan. If you go back to Barry Quote's Doubling Down paper last year, talked specifically about the integration of parts of the organisation and of partners with whom we work.
It sounds great, the less duplication that's
And then it comes back to that lovely statement from the parent who said, I want to go to one person, ask one question, have it in one place.
You were talking about, the savings you've made just in that one little area of your departments in integrating services without reduction in services, it's still a saving. Any savings we make, we can then use on our young people, can't we? So that would be a lovely ambition.
I wonder if we were given your previous within your previous request around the hierarchy of need and services that what goes up, what goes down. If we produce something that identifies that in more of a robust way, that we can then share some ideas around what could lead to some further integration. Because I think you're right, it's not integration that's just around children's services, it's got to be much broader than partners. So your influence is influence, and our influence as officers is influence with our partners.
The other obvious thing to me is we're a very small borough with very limited land, with assets across the land, and we are very short on housing stock, etc., etc. So we could be helping so many different departments with this thinking.
But I think this fits into, and I'm glad I raised it now, because we're not yet at the end of the year, and obviously next year's committee decides on its programme in formal terms. But I think to start the conversation now with you as officers,
As you for
with a view to that being something that you identify, or what part of the question I've asked is relevant and what perhaps what part is not. Very useful.
I think it's intense. Might be a best,
You happy with that?
I'm very happy.
Jackie, you happy with that?
Can I bring Jackie in? I was just going to say, and Councillor Pascal's partly alluded to this, we were talking about the April meeting, but of course in sort of May, June, I'll be leading on the consultation, the admin on behalf of councillors for the next year's work programme, which starts June, July. So another thing you might want to think about is what's it appropriate to do in April and what might you
Jackie, what I'm suggesting is, if it was possible for example, each of this team to come back with a response to the question I've raised, rather inarticulate, and focusing on it in a more professional way than I've been able to today, and say, the posed an interesting sort of philosophical question. Out of that philosophical question, this is the reality of our next steps. And this is something that might be really useful to look at in how services are brought together to the maximum benefit of that, looking after that child, the team for the child.
You're talking about vision, really, aren't you?
Child's personal team.
Personal team
Other
around
than
the
staff.
child. Team around the child.
I didn't think of it like that.
You really think it.
We'll pretend it's yours.
Without you, it wouldn't have
Any
been my
other
conscience.
So from an admin point of view, I'm at your disposal if you want to decide now what you want to do at the next meeting, or if you want people to write to you, Wella, as the chair.
Yeah, which is better for you guys? Do you want to think about it and write on it?
Chair, would it be possible for me to, I mean, subject to what you and everybody else around the table want, but can I propose that we ask the officers to respond to this debate we just had? Because I think they've got such an enormous repository of experience in these that they could provide something useful for
He
us.
is really throwing you.
Yes, you're really.
He's doing a Pascal.
But I think we don't need a great, process about this. Just a short paper of, bullet points
Yes.
to discuss at the April meeting, having thought about it a bit,
Yes.
a realistic possibilities. Because maybe what I put forward is a completely, pie in the sky idea.
It's actually massive.
It is massive.
It is
No,
massive.
but out of
So
that,
we'd have to look at a timeline and process.
it's sort of,
Yeah.
it's out there.
We
Come back to something realistic. This would be
It
sensible
could be
to
a
look at.
2-year work programme that we do.
So what would be the next sensible step in this conversation? Seen from your point of view, would be a very useful short paper for the next meeting. If I can I propose that?
You can.
Yeah, we can.
Okay. And I think he accepted already, so okay.
I bet you wish you'd gone earlier.
You could come back with an answer no. Can't possible.
Yes.
We'll reflect.
Yeah.
Yeah.
Discuss.
For April, and I think. Shall we confirm this for April?
Yes.
Yes.
So, do you want to do any of the other options, or is it just?
I suggest libraries.
Yes.
I think we need to look up at some kind of blue sky thinking about libraries and what we can do with libraries.
Yeah.
Sorry,
Read on that.
So, I don't know, do you guys agree?
So do you want to do North?
But that's a whole new thing.
Everywhere.
Does library sound okay?
Could I ask one little
But
comment?
it's to the point there, that's a whole new thing.
Yeah. But what would be very useful?
Sorry, Jackie. Sorry, Chair. Sorry, I did speak to Sarah. You don't have to do what she says. It's up to you. It's councillor led. But her suggestion was how are communities utilising libraries and whether we've got the service offers in each library. So she's defined it.
Yeah.
So you can not do libraries, you can do what she's defined, or you can do something else. But I just thought it might be helpful because Amanda thought it was quite a big topic to do.
Well, no,
libraries, so
the
that
only
was
point
what she
is
thought
we've
would be
been
helpful.
talking about library visits, etc., etc.
Yeah.
So that's not just a neat little thing we do in that
No,
one
no.
meeting.
I mean, usually what I would do is when you've decided as a committee, I would work with the chair and colleagues to scope something out. So I think the report at the meeting would be about how communities are using the libraries, and as I suggested, you
And how
would
we
go
can-
out and look at the service
Yes,
offices.
exactly.
So Dorry can go to Notting Hill Gate and say, are the service officers there? Will
They're none.
residents see them? Are they well displayed? Are they appropriate to all different members of our community? So it would be about that.
Prior to the April meeting.
I should suggest that. I mean, because good scrutiny is about going out. It's not just about,
Esther?
There was anomaly in one of our youth clubs.
Sorry?
90.
Anomaly in one of our youth clubs opened
Yeah.
by one of the councillors. Why don't we look at that or visit so that there will be spot checking on what they're really doing? Or no, it's just, it is not an ongoing program, it's just a suggestion.
Yeah.
If there's a problem.
I think it's important to say that obviously libraries are going to be new
Yes.
to children's
Yes.
services.
Yeah.
So actually I think the steer from Sarah is very much around your intelligence.
Yeah,
It will-
yeah, exactly. What do you
It will then
think? Yeah.
help children's services to think about how
Exactly.
we would then capitalise on.
Yeah.
Absolutely.
And then I think us each, we don't all have to visit all the libraries, there's not that many of them, but we can each visit a group of, a couple of one, and then come back and feed to the group what we saw and where we think they can go.
So I'll do maybe a little
like
pro forma or something. About what to look for. So
exactly. Absolutely.
So going back to what I said before, so everybody is. You might see extra things, whatever.
Yeah.
So we can get a report together.
So two items is
Sorry.
enough.
Do we concentrate on children or, in general? What the
Library, just community.
What do you think?
Community, okay.
Yeah, community overall.
So are the NEET, is the NEET item on or off now for this? Because that was very much that you wanted at the beginning of the year to go and visit, so you might feel you haven't got the capacity now.
So how many topics do we have now?
Well, you've
So we've
got
got the libraries.
Will's suggestion and libraries.
Yeah, I think we can we skip it?
It's up to you. It's your meeting.
It's your
Quarterly report.
and it's two.
Quarterly report, don't forget.
Yeah. So I think we'll leave it because
I'll let colleagues know.
Okay.
I think it's important you hear things well.
Exactly. There are a lot of things. I mean, look how much we're supposed to finish.